had not been properly advised of the allowances that were due for collection. This was despite the fact that various modes of communication, such as telephone, radio, television, could have been used to good effect in the midst of COVID-19 restrictions. Therefore, the committee recommends that the Ministry of Public Service, Labour and Social Welfare should communicate with the intended beneficiaries, ensure that the allowances are disbursed within 90 days of tabling of this report. Madam Speaker, may I move on to payments of COVID-19 allowances to members of staff. It was noted during the audit that members of staff stationed at Toronto Quarantine Centre, Magwamba Quarantine Centre and Matabeleland South Provincial Social Welfare Office were paid COVID-19 allowances totaling to 2.290 million. These allowances were paid to members of staff who reported for duty during COVID-19 lockdown period from April to July 2020. The payments were made without competent authority. Furthermore, there were inconsistencies and lack of documented guidelines on payment of the COVID-19 allowances across different government departments. The amounts paid range from $180 to $320 per day. The committee's observation was that whilst the fear of contracting COVID-19 was real and the need to pay staff allowances was considered noble by the Ministry of Public Service and Social Welfare, failure to seek the necessary approval for payment of allowances cannot be condoned. The Ministry officials could not provide the committee with the number of staff members who benefited from the corresponding amounts they received, and this was perceived as efforts to conceal information for unauthorized conduct. The committee therefore recommended that the ministry should seek authority from the accounting officer in retrospect and if approval is not granted, recover the allowances paid. The exercise should be completed within 60 days after tabling of this report. Madam Speaker, may I move to urban food assistance. Madam Speaker, Section 4(3) of the Social Welfare Assistance Act, Chapter 17.06 requires that from time to time reviews, assessments be conducted to determine eligibility of persons intended to receive social welfare assistance in terms of amounts or level of social welfare assistance. The Pepe and Shamana Social Development Offices did not avail for audit, inspection, documentary evidence to show that urban food beneficiaries who received cash disbursements totaling to $187,000 and $3,806,000 respectively during the months of April, May, July, and August were assessed to determine whether or not they qualified to be in the urban feeding program. Therefore, the committee's observation was that failure by the ministry's officials to submit records of assessments to the Auditor General and the subsequent failure to avail the same to the committee is clear testimony that proper procedures were not followed. As a result, undeserving people could have benefited at the expense of those who deserved the allowances. Therefore, the Public Accounts Committee recommended that the Ministry of Public Service, Labour and Social Welfare conduct a review to determine eligibility of persons who should benefit from social welfare assistance within 180 days of tabling of this report, and a documentary evidence of periodic reviews, which must always be kept in files and made available to the AG's office upon request. A schedule showing payments amounting to $18,300 for 27 inmates at Mshagashi Quarantine Center revealed that the inmates received the bus fares on September 10, 2020. However, the admissions and discharge register indicated that the inmates were discharged on September 22, 2020, 13 days after payment date. Out of a total amount of 597,460 paid, inmates whose bus fare payments amounted to 516,370 did not sign for the acquittal forms at Mshangashe Quarantine Center as proof that they had received the amount indicated. The AG could not confirm the accuracy of the expenditure figures in the absence of supporting documentation. The committee observed that there was serious breach of the provisions of the Public Finance Management Act by officials who did not keep proper records of accounts, and therefore recommended that the Ministry of Public Service, Labour and Social Welfare should expedite investigations and finalize this matter within 120 days of tabling of this report. And the report of the findings of the internal investigations and remedial action taken by the ministry should be submitted to the AG's office and the Public Accounts Committee within 180 days of tabling of this report. Mr. Speaker, I'll move on to payments of administration fees for quarantine centers. Mshangashe Training Center charged accommodation and service fees to the Ministry of Public Service, Labour and Social Welfare for the use of its premises as a quarantine center. The fees were purported to be based on a number of inmates resident at the center on each day. However, there was no authority produced approving the basis of payments. Furthermore to the above, a total of $6,993 was billed between the period of April 7, 2020 to November 14, 2020 for the services rendered, and $1.5 million had been paid by the ministry. The invoices were not supported by records of the number of inmates for the period and the administration services that the ministry was billed for by the institution to enable the Auditor General to validate the invoice amounts. The committee observed that the Ministry of Public Service and Social Welfare made payments to Mshangashe Center for use of its premise as a quarantine center without any form of contract entered into. Contracts by their nature define and govern the rights and duties between or among parties, and in the event of a breach of contract, the injured party may seek judicial remedies such as damages or cancellation. Lack of supporting documents for payments made for inmates that were accommodated at the institution is not excusable accounting practice. There was also the absence of a decommissioning policy, which is an anomaly which should be rectified. Therefore, the committee recommends that in future programs, the ministry should enter into contract or at least sign memorandum of understanding with the service providers without fail.